After working with hundreds of dietitians, I have learned what are some of the most common mistakes that they tend to make in sessions. And I can see how those mistakes can be contributing to clients getting overwhelmed, to clients maybe thinking, what's the point? Like, I have all the information, I can do this on my own, and eventually dropping off of the radar. So I have put this together based on all the information that I have from talking to so many dietitians and reviewing their sessions, and then putting it together in such a manner that can help you try to avoid some of these mistakes, because I'm going to go into some of the top mistakes and then also give you some tips to overcome them. So for those of you who don't know me, if you're new to my world, my name is Joyce Faraj-Ardura. I love my café con leche. So if you're ever following my Instagram, you're going to see me with my coffee in the morning when I'm like doing my first story. I'm from Honduras and I've been in the US for over 20 years. I'm a mom. I love teaching, and I found out very early in my profession as a dietitian working in a clinic that my counseling skills were not very good. I'm going to share a little bit of that story with you. And that's what got me into the nutrition counseling world. And I founded the Nutrition Counseling Academy. I also have a private practice. And I do consulting work, I do public speaking, and I teach at the university level as well. I am a former tenure-track professor of nutrition and dietetics. So let's get started. I want to make sure that you're in the right place. You're in the right place if you know that there is something missing in your nutrition sessions or consults, and you're wondering what that might be. Maybe you're thinking that you're having an amazing first session, you're having a decent second session, and then by the time you get to the third or the fourth session, you're running out of things to talk about with your clients. If that resonates with any of you, go ahead and type a 1 in the chat. You might be finding that clients become disengaged, specifically like during session as well. Like you're noticing they're starting to wander away. You're noticing that they're not really participating actively, or maybe even wondering if they even want to be there. So then you're noticing they're losing motivation in front of your eyes in session. This is something that you noticed, go ahead and type in 2 in the chat. If you feel that you're working more than your clients and you're feeling burnt out, or you're reaching that point of burnout because you feel like you care more than your clients about their progress, you feel like you have to do more, like you have to give them more value, or like more handouts, or like do more things, and that's exhausting. If this is you, or if this resonates, go ahead and type in a 3 in the chat as well. So our plan for today, thank you. Okay, so I'm seeing the chat. I'm seeing lots of 1s, 2s, and more than 1s and 2s, lots of 3s. Interesting. Okay, wonderful. So I'd love for you to take a moment, and if you could describe your nutrition counseling sessions or your approach in one word, what would that word be? If you can just sum it up into one word to describe your nutrition counseling sessions or your approach, what would that one word be? Personalized. Wonderful. Collaborative. Ooh, spot on. I love it. Open. Okay. Motivational. I like that. What else is coming up for you? Personalized, collaborative, open, motivational. Compassionate, individualized, mindful. Lovely. Now, if you could sum your nutrition counseling struggles into one word, what do you think that word might be? If you were to sum your nutrition counseling struggles, summarize them into one word, one descriptive word, what would that be? Okay, I'm seeing some disinterest, defeated, Inadequate. Okay, thank you for sharing. This is a very vulnerable question. Stuck. And sometimes the same things that you might be experiencing, your clients might be experiencing too, whether it is the positive or the negative. Discouraged. Okay. Thank you. Thank you for sharing. So I'm going to keep all of these in mind as we go through today's presentation. So what I have for you today, we're going to go into the difference between nutrition education and nutrition counseling. Then we're going to shift gears and go into the top 5 mistakes and how to avoid them. There is a worksheet associated with this, and you should have gotten that via email as well. If you're missing that link, let me know and we can have it posted on, what do you call it, on the chat as well. And then I'm going to let you know when we're done with the webinar, and then I'm going to show you what next steps would be if you wanted to continue elevating your counseling skills. So by the end of today, you'll be able to identify the key differences between education and counseling as far as your work as dietitians and nutrition professionals goes. You're going to be able to list the biggest predictor of positive client outcomes. Thank you so much for sharing. You're going to be able to assess how many of the top mistakes you may be making in session. And Carly just posted the worksheet, I believe. Thank you so much. So you should be able to click on it and open it. And then I would love for you to think about which of the strategies that I go over are going to be the ones that you want to try out in your next sessions. If you end up staying till the end, I do want to raffle a couple of planners. And these are planners that I actually made. They're not out in the market yet, but this is a professional development planner for dietitians. So you can keep track of your CEUs, but it also has a lot of behavior change strategies and prompts put into here. So if you're interested in winning a planner specifically for dietitians and nutrition professionals, then stay till the end. Something to keep in mind before I forget. So then let's see if any of this resonates with you. I often feel that sessions are going well. I provide so much value and clients leave with a plan, but they fail to follow through. Now, these are all statements that I've heard from dietitians as I've been talking with them. So if this resonates, write a 1. I often feel that I'm working harder than my clients, doing extra research and convincing them of why they need to make dietary changes. To no avail. Type a 2, if you feel that way. I am an expert in all the MNT, medical nutrition therapy, nutrition science, but this is not translating into action or behavior change in my clients. Type a 3, if this resonates with you. And the last one I have here is, I make it a point to focus on nutrition education and sessions so clients know that I'm worth it, that the session is valuable. Giving more education, more handouts, more tips so that they have the knowledge with them. You can type in a 4. So we got 1, 2, 3, and 4, if any of these resonates. And I'm going to go into why some of these, all of these already have some red flags in there. If you often feel that sessions are going well, you provide lots of value, and clients leave with a plan, you're going to know exactly what might be missing when they fail to follow through after today's session. If you often feel that you're working harder than your clients, doing extra research and convincing them of why they need, like, why is this important? Then you're going to know which of the top mistakes you might be making when you're feeling this is what's going on in your sessions. If you're an expert in all this science, but it's not translating well, it's falling onto deaf ears with your clients, it's not translating into behavior change, then we can pinpoint what might be some of the obstacles there. And if you make it a point to focus on the education so that clients know that you're worth it, this is especially true when you have a private practice and you feel like you need to give more value and more worth. And sometimes we end up working more than our clients. So then we need to shift how we view worth and value in our sessions. If anyone's unmuted, I'm going to ask you to please mute. This is being recorded. Oh, there we go. Okay. Okay, so let's jump into the first one. No peeking. You actually have these on your worksheet. I'm going to go into the top 5. I actually wrote the top 10 here that I tend to see. Let's start with the first one. So over educating versus counseling. That's the top mistake that I tend to see in sessions. And I'm going to go into what the differences are. So when we think of nutrition counseling versus education, for me, these are two very distinctive but complementary interventions within the nutrition care process. But if you know me, you're going to know that I think that counseling is so much more than just an intervention. It's how we do what we do as dietitians. So I'm taking the definition from the from the Academy of Nutrition and Dietetics about what nutrition counseling is. It is a collaborative relationship. I love seeing how some of you mentioned collaboration to define your nutrition counseling sessions. A nutrition counseling process needs to be collaborative, and it also needs to be a relationship. So there's something that tends to be missing when we are seeing maybe way too many clients. We're back to back on our schedule with clients, or we're in an inpatient setting. We don't have that opportunity to really build a relationship with our clients.
Thank you.
Then we have counseling is work together to establish food, nutrition, and physical activity priorities, goals, and action plans. Again, collaboration to establish those priorities, goals, and the planning. Then we have conversations that acknowledge and foster responsibility for self-care to treat an existing condition and or promote health. And I want to make a distinction here that when it comes to coaching, coaching tends to focus on the present and the future. When we think of the word counseling as a bigger term, it also focuses a little bit on the past. So we can help clients make sense of what got in the way in the past so that they can understand how to best move forward. We tend to dig into deeper conversations when we think of counseling as well. Now, how does this differ from education? It differs because education is meant to be an intervention. It's a formal process to instruct or train a client in a skill or a knowledge. So it's going to be something they learn how to do or some information that they're going to learn that's going to help them in their journey. Now, this is one of the biggest pitfalls. We make the assumption that knowledge leads to behavior change. If people only knew what they needed to do, they would do it. Now, we know that's not necessarily true all the time. So I believe that education is complementary to nutrition counseling, but not to be used exclusively, meaning that it's going to be a small part of your sessions. And what dietitians and nutrition professionals end up doing in session most of the time is education. And this is why that ends up being a problem. Knowledge does not equal change. We've heard this saying, knowledge equals power. We've heard this most of our lives, right? But research has shown that even though education is a necessary component of behavior change, knowledge does not guarantee people will change their behaviors. Just by a raise of, I guess not a raise of hands, but you can type it into the chat. Can we think of something we know we should be doing, and yet we aren't doing it? I'll be the first one. Like, I know what the guidelines are for nutrition, for physical activity. I know I should be taking better care of myself, and like reducing my stress and things like that. I know that. And yet it doesn't always translate into change. Or just think of your clients that tell you that they know what to do, but they're not doing it. So then knowledge doesn't equal change. If knowledge deficit was the main issue, then knowledge would solve that. For most clients, it's not going to be just knowledge deficit. It's also going to be obstacles to them actually starting with new habits. And this is where we are at a loss, because multiple times throughout our training, we focus on nutrition education, and smaller instances of actual counseling. And we focus like 98% of our training on the science. And this is where we're left at a loss, because nutrition is a science, but eating is a behavior. This is the simple fact that it comes down to. And I don't know about you, but when I realized this, my mind was blown because I was focusing so much on the MNT, on the science, that I was not focusing enough on communication skills for behavior change. And I'm here to say that you're not alone. You're not alone in this at all. But before I go into some of the statistics, I would love for you to change your perspective and to tell yourself, I am not just a nutrition educator. I am a nutrition counselor and a behavior change coach. And this is the identity shift that we need to start embodying so that we can better support our clients' behavior change so that they can integrate the evidence-based MNT strategies that you are going to be an expert in that will help them reach their outcomes. Otherwise, your MNT and your nutrition strategies are all going to fall on deaf ears if we don't know how to communicate in such a way that's going to increase their own intrinsic motivation, that's going to help them get started, that's going to help them troubleshoot when they do get stuck. And this is not something that's taught enough. Or if it's taught when you're in your training, your DPD or your CPD, your dietetics training, it's very different to learn this and practice it when you're a student versus when you're actually seeing clients and patients. And I'm here to tell you, you're not alone. This research published 2 years ago, they did a survey, I think it was 1,000 dietitians or so. And they found that 93.7, I rounded to 94, 94% of dietitians, these are registered dietitians who are already practicing within the profession. 94% stated that they needed additional training on communication skills for facilitating behavior change to be able to better support their clients. So this is a big area where many of us have been just lacking that training. And that's basically it, right? So if you know, I want to say this is not your fault. Although the Academy of Nutrition and Dietetics recommends that dietitians incorporate proven counseling methods, such as motivational interviewing, to help clients facilitate desired behavior change, we're not always giving enough opportunity to learn, practice, and master such skills in our training. Also, this is from published research. So then this is my take. My take is that the communication skills that you have to help your clients navigate behavior change are just as important as the nutrition knowledge you have to support the changes. Otherwise, your MNT is falling on deaf ears. Otherwise, we're overwhelming our clients with all the information. And I want to go into what happens when we continue to make this mistake, right? But it wasn't always like this. A little bit of my story. So going back to, gosh, I think it was 2006, I was full on into nutrition science, actually into science. It was more than just nutrition. I majored in immunology, nutrition, and immunology and nutrition. So I was a microbiome major and a nutrition major. I did a double degree. So I was all about how, the body's immune system worked in relation to nutrition. And many of my research throughout graduate school also was related to inflammation and nutrition and the immune system. And then I started adding mental health to it as well. So I was looking at how micronutrients or intake affected inflammation and mental health. And that connection to mental health started to get me thinking about how we do things, and not just the what, like the nutrition, the nutrients, but also how do we end up choosing the foods that we eat or don't eat? How do we end up making decisions? But back then I was really into science. In Stanford, 2006, I did an internship there. And I remember I was the only girl in this lab, a bunch of men in there. I was the only girl undergrad working in this lab, and we're looking at T-cell receptors. Little did I know that principal investigator I was working with, he actually was nominated for the Nobel Prize that year because he discovered the T cells. Before that, it was all B cells. So we were looking at T cells, and then I had a meeting with him. And I remember him asking me, I was so nervous. My hands were sweaty. I'm like, this big shot, big name. And here I was, little me. And he asked me, so what are your plans? And I said, well, I like to continue with nutrition. And he just looked at me. He's like, but why? You're wasting your time. I'm like, what do you mean I'm wasting my time? I like nutrition and immunology and then how it works. He's like, you're wasting your time because people don't change their behaviors. People don't change. You should just stick to immunology. And then it almost felt like he was making fun of the profession. So I thanked him for his time. Obviously, for me, it meant a big deal to be working in his lab, but that didn't sit right with me. And just, it was at the back of my mind for years. So then fast forward, I became a dietitian. And then I was hired to create and manage a nutrition program at a substance use rehab. I was a pretty good student. I was paying attention when I had to. Then when I was hired to create this program, I created this beautiful program. I knew who I was going to be seeing, what screening tools I'd be using, what diagnoses, what the process or the procedure was for everyone that I'd be seeing. The billing, I figured that out too, like all of it. And then I started seeing clients, and I soon realized that what I had learned during my counseling class in undergrad or my dietetic internship was not enough. It was not enough to be helping these clients who were not wanting to change or not wanting to be there. And then the words that that PI had told me years before were resonating in my head, thinking people don't want to change. And I thought that can't be true. Like people do change. And I want to say that hope needs to be one of the last things that we ever lose. It has to be the last thing that your clients lose as well. So we have to be able to give our clients hope. And I kept on thinking, like, how could we have professions such as psychology that dedicate the whole field to studying behavior, and someone here saying that people don't change? And then I thought, wow, if other professionals in charge who are experts of diet and lifestyle and nutrition and physical activity are not trained in behavior change, how in the world are we ever going to make a difference and prove people wrong when they say people don't change? So then that's when it clicked on me. I needed to get better at behavior change psychology and behavior change science so that I could help my clients change, because I refuse to believe that people cannot change. Lucky for me, I was the only one working with, the only dietitian working with a bunch of psychologists and therapists and social workers. And I heard how they spoke about behavior change. And that's when I realized there's more to this. There's more to what I've been taught, and I want to learn. I want to be in those conversations. So I would sit with them in their group supervisions. I would go to their workshops. I really got into MI because of that. And if you know anything about motivational interviewing, it kind of started and it became very popular amongst addiction and substance use rehabs. So then I was in the perfect place to develop these skills. And then I started branching more into nutrition skills, like getting more training on eating disorders and intuitive eating, and blending that with MI and with all these different ways of viewing and talking about behavior change. And then I started to notice a change. It was like day and night, how clients were approaching the sessions based on how I shifted my approach was really, really wonderful to see. They were more open, they were more willing to like talk and do things. And it's because I had shifted how I spoke with them in session. I shifted my own attitude as well. It was no longer, oh, this client's not motivated. It was like, okay, let's meet them where they're at and let's start there. So I started to think about the stages of change and how to come up with appropriate interventions. And it was beautiful to see how that shifted the energy in sessions. This is just a little bit more about me. I then jumped into academia, and I was there for the past 4 or 5 years teaching nutrition counseling within different classes at Framingham State University. And then this is probably one of the only pictures I have with my kids, because moms don't get into pictures that often. I have a 6-year-old, a 3-year-old, and a 1-year-old. So I'm also a mom, and that's a big part of the reason why I do what I do and why I shifted gears going from academia into entrepreneurship. So since then, I started the Nutrition Counseling Academy when I realized that more dietitians needed this. It wasn't just students that needed nutrition counseling, it was dietitians that needed the support. So I have free trainings all over, like YouTube. I have the Facebook community. If you're not in there yet, I recommend you join it. If you're familiar with the Empowered series to help dietitians enhance their counseling skills, I'm the one organizing these as well. And there's a membership that I came up with. It's all about nutrition for behavior change, coaching for behavior change science for dietitians. And that is how I got to where I am. And through these different programs, I've been able to talk to so many dietitians, and I've also reviewed sessions. So I audit nutrition counseling sessions. And besides over educating, which can really lead to information overwhelm and not enough support for behavior change, I'm seeing dietitians fall into the writing reflex. This is basically, or I guess it's now called the fixing reflex. This is the second biggest mistake that I see. How many are familiar with this? The writing or the fixing reflex is our own innate desire to help. I mean, it makes sense. We're here because we want to help. Dietitians are helping professionals, are helping profession. We want to help. So it comes from a good place. But this is the biggest issue I see. This is basically us telling people what to do. And you might be saying, but aren't they coming to me so I can tell them what to do? Yeah, you're not wrong when you say that. The thing is how we do it. Remember, it's just not what we do, it's how we do it that's important. So then can you see a problem with telling people what to do or jumping into, like Brittany said here, it's hard not jump right into problem solving. So it tends to be well-meaning, but it's whenever you start a sentence with, have you thought about doing X, Y, or Z? Or you should really try this, try to have more protein with your meals. You need to drink more water. Why don't you add more fiber to your morning snack? So then they're coming from a good place, but just take a moment to think about the last time you maybe share something with your partner or a friend and they immediately told you what you should be doing. I mean, I can tell you, I remember the last time my husband told me, I forgot what it was that I told him. I was just like venting. I guess I was just like complaining about something. And he's like, well, why don't you do this? I'm like, whoa. First of all, inside, like something shut up, like something shut off. And I was feeling defensive at that point. I'm like, I don't like this feeling. Like, why is he telling me to do that? I didn't ask him to tell me. So it's very different when I go to him and I say, I just had this issue, and I'm not sure what to do. Can you help me brainstorm? Than me just sharing something and all of a sudden him saying, well, why don't you try this? Or why don't you do that? So I'm not here to say you shouldn't share your expertise. You should. What I'm here to say is how we approach that conversation is going to make or break how open and actively engaged and willing your client is to try your suggestions. So then what do we need to do instead? Most people know or have some idea of what they need to do, but they might not know how to do it, how to be consistent in doing something, what the most effective way of doing things might be. So it's up to us to help them detangle many of these things, find the knowledge gaps that they might have, fill those with the information they need, and then ask them to basically process that and come up with a solution. And if they're not able to, then go ahead and share your solution. I'm going to show you what you can say. It's a little bit different when they ask you. They're specifically saying, Joyce, what can I do? As if that when they go ahead and you do your assessment and you're like, okay, so I'm seeing this, and these are the different interventions. Let's start here. You're imposing on them. There's a strategic way to share your expertise so that if it sounds or it feels better to your clients. So then this is my suggestion. Instead of jumping in, recognize the desire to tell your client what to do. So that's that awareness that you have that writing reflex or fixing reflex, and just tame that reflex. And then you can do something like this. You can ask them what they already know about X, Y, or Z. Like, what do you already know about how you can manage your blood sugars with diet or lifestyle? And then you hear them out. You affirm their efforts. For example, if they say, well, I've heard that eating more protein helps, you can say something like, well, it sounds like you already did some research and you found that eating protein can help blunt that blood sugar spike. And then just saying something as simple as reflecting what they're saying, this is something that's important to you. And I can see that because of, everything you've shared so far. You can make them feel better. So you hear them out, affirm their efforts. Then you can also ask for permission. Maybe they're already told you, like, share some strategies. You can just say, well, so if it's okay with you, I have a couple of things that I know are probably going to work very well given your circumstances. Or I have a few ideas that have worked really well for others. And then, is it okay if I share? Are you ready to look at them? Just by asking them that small, like, is it okay to share? Do you want to look at them? It helps them feel like they're in control. Ultimately, they decide what to do, when to do it, how to do it. We're there to guide them. But reinforcing that autonomy is going to help them feel better about it. So then you provide the suggestions, give them a menu of different topics, menu of different strategies. That's where your expertise comes in as well. And then ask them, which, if any, of these would you like to try? That small, if any, that you're seeing here emphasizes autonomy once again. And this is another way of them feeling like, okay, like my dietitian really, it really matters to them what I want to do and how I feel. So that autonomy is going to be a big part of them actually taking on the responsibility for their own behavior change. So before I shift gears to number 3, I want to see, anyone have any questions? Has anyone, feel like something you like to try out if you haven't been doing it? It might sound very simple, but many times we get so excited to want to help that we forget to do this. So if you are taking notes, I'm going to give you a couple more seconds so you can write it down. And I'd be happy to share these slides if you want them as well when I share the replay. Then we have mistake number 3, not having structure in session. Did I mention that I review nutrition counseling sessions? So this is like really neat. I actually review sessions and people can submit a session and I review it for them and I run it through this specialized AI software that's going to transcribe the whole session. And then it's going to highlight everything the dietitian says, what the dietitian says, and then it's going to basically write in, is it a reflection? Is it a question? Is it an affirmation? If you remember from MI, those are some of the few things that we pay attention to. And I see dietitians trying to be very nice in session. And then that ends up with them letting the clients lead the conversation and the conversation's all over the place. So then this can also inhibit your client's progress because if the conversation's all over the place, it's really hard to just focus it down. If anyone struggles with not having structure in session, go ahead and add a 3 to the chat. This one that I see very often. And it comes from our desire to want to let our clients talk, but it ends up being detrimental. So then lacking structure. And this comes from the clients wanting to share and us trying to be very nice and letting them share. I also have I think I have a whole webinar on, how to keep sessions on target when we're talking with clients, because it's easy to deviate into other topics. So clients want to share it all. So instead, we need to take the lead. We need to guide them. And this is really important so that they know what to expect. That predictability in session is going to help them know what to expect, but also reduce their anxiety, make them feel more calm about what's gonna happen in session. This is just like a sample. Let's say you're doing an initial. You can say, first, I'll ask you some questions to get an idea of where you're at and what you're struggling with. So whatever your process might be, you can type it out and then basically have something to share with them. This is just an example. Then we'll dive into your nutrition story and what's worked, what hasn't worked. You can then assess behaviors and attitudes towards change in this particular segment of the session. And then we'll discuss what you can expect from working together, and we can dive into next steps. How does that sound? And again, we're like reaffirming their autonomy. Just knowing what to expect is going to be really helpful for you and for them to kind of stay on track. If it's a follow-up, depending on how you structure your own follow-ups, it could be something like this. First we'll go into what has been working for you, then where you might be struggling, and then either dive deeper into brainstorming solutions or discuss next steps on a roadmap. How does that sound with you? Does that feel okay? And then they're going to say yes or no, or if they want anything else, then they're going to let you know. So just having that structure can really help. Now, if you remember anything from motivational interviewing, they tend to emphasize 4 different conversations. They now call them tasks. They used to be processes. So basically, in these 4 different types of conversations, you can have an engaging focus. This is when you're beginning to build more rapport. So when you're engaging with someone, you're making them feel heard and seen. So you're doing more reflections. Is someone saying, wow, I'm really struggling with finding the time to like prep my meals, but I am writing down the things that I need to buy. I just don't have the time to prepare them. A simple way to make them feel heard and seen is like, it shows that this really matters to you because you're taking the time to write it down. Just something like that is going to be reaffirming to them. Like, wow, she's listening, right? So trying to find that emotion, that meaning to whatever they're saying, and say it back can help with the engaging process. And this is going to build more rapport. Then we have focusing. This we're going into the target or the topic of the session. This should be related to a particular area of behavior change. If it's, let's say, diabetes, then it might be managing blood sugars. Then you might want to figure out what is it that they want to focus on as it pertains to managing blood sugar. So that's where you give them like a menu of options or help them brainstorm what's feasible for them, what area they want to learn more about and start working on. So you choose that focus. Then you tend to start to evoke reasons for why is that important to them. Why did they choose that particular focus? Maybe they're not ready to deal with food right now, but they chose walking after meals. So then why did they choose walking? Just out of curiosity. You have to be genuine with this, but that's going to help them increase their own intrinsic motivation. So if you recall from MI, this is where we're evoking change talk. Change talk are all the statements that a client will say that indicate their desire, ability, reason, or need to want to make a change. You're going to take that and reflect it back. And once they hear it from you, based on what they said, it just sits differently in a good way. So then we're going to be evoking that, and then we're going to go into planning. This tends to be the 4 different conversations. When we're going into planning, we assess barriers and come up with a high confidence next step for them. Now, this one goes in line with the next one. They kind of go hand in hand. And this one is jumping into planning too quickly. So sometimes we're going from focusing, we determine what the issue is, and bam, we go straight into planning and we skip the evoking altogether. So then what happens when we skip that altogether? You might have a client that has a really neat action plan. You can have a smart plan, smart goals for their action plan, and very little to no motivation, no discussion of barriers. They might have low self-efficacy, low confidence, and we might be setting them up to fail. So we have to keep in mind that clients might be coming to you feeling very ambitious sometimes, and they just want to get right into planning and doing. But we have to have these conversations so that we can set them up for success. And I'm going to add to this that even if clients are really ambitious, I would probably say something along the lines of, okay, let's work on one action goal now, and then, see how it goes. If they're eager for more, then give them 2 or 3. Tell them that if they have difficulty doing all 2 or 3, to just prioritize that one thing. because you want them to prove to you they can do that one thing more or less consistently before you add another and another thing. Otherwise, they're gonna feel like, what's the point of coming back? I already know what to do, and I still can't do it. So then we want to make sure that they're more successful. And I don't recall where I got this from. I remember reading it years ago and it stuck with me. People are more successful when they stick with one thing. I think it was like an 80 something percent success versus like a 15 or 20% success if they add on 2 or 3 things. So the more things they add on, the less likely they are successful. And when it comes to habit creation, we want to start simple. It has to be, you can say it has to be too easy to not do it, and then you can make it more and more challenging as you go. So then jumping into planning can be detrimental. On the other end, going too slowly and spending too much time evoking motivation when your client's already pretty motivated can actually decrease your client's momentum towards change. So it's learning to dance with our clients at their pace, meet them where they're at, and adjust as necessary. And that's going to be key. And that's all something that you learn as you practice more motivational interviewing and having like sessions reviewed, that you can pinpoint if you're getting ahead or if you're falling behind, so that you can meet your clients where they're at, but also kind of like dance with them when it comes to having these conversations about change. Also sensing their body language and paying attention to their change talk is going to be key to know if you will need to stay more time on a particular process or if you are okay to move on to the next one. Okay, how are we doing? I think we're doing good on time. We're almost at the last one. Number 5. This one is failing to establish a strong therapeutic relationship. Now, from psychotherapy research, the therapeutic relationship or alliance, whatever you want to call it, is the #1 predictor of positive client outcomes. Let that sit in. The therapeutic relationship is the #1 predictor of positive client outcomes. Now, this is where I see dietitians taking a wrong turn, per se. We often feel the desire and the need to show off our expertise. Why? Because we are fighting against misinformation on the internet, against Dr. Google, dietitian Google. We're fighting against a lot of misinformation on the internet in general, social media. There's you name it. We all know what that is, right? So we feel the need and the desire to show off our expertise, and we tend to prioritize education and showing off what we know over connection. Connection is what's going to keep your clients engaged. It's the best way to establish strong rapport as well. Google's not going to give your clients connection. Your counseling skills is what's going to give that connection and help them maintain engagement and help them feel supported and make them feel like they can actually do the things you're talking about doing. So then how can we connect with our clients? Making them feel heard and seen. Someone responded to the email. One of the tips that they want is, I want to learn how to ensure my clients feel heard so they will want to return for their follow-up. Feeling heard, feeling seen can be as simple as reflecting what you're hearing them say. It is also showing genuine interest and empathy. Empathy is trying to connect with what they're saying or feeling based on an emotion that you are familiar with. Now, we often skip reflections, and this is one of the 101s in motivational interviewing. Reflections. We actually guide with reflections. In motivational interviewing, for every question that we do, we should be doing 2 reflections. So we're guiding with reflections. And it's these reflections that are going to help your clients feel heard and feel seen. I've talked to dietitians who are like, oh, I don't like doing reflections because they sound weird. They're not like natural. Of course they're not natural. It's not a natural way of speaking to reflect on what people are saying. When we talk with someone, our brain goes into finding similarities and then sharing our own experience. That's not what a patient-centered approach is. When we are in a patient-centered approach with a client, the focus needs to be the client. The focus is making the client feel like we are hearing what they're saying. We see how hard they're trying. We see what their obstacles are, and we're there to support them. So they feel that support. So I would emphasize reflections, whether it is reflecting the content of what they're saying, very simple. You can reflect the meaning behind what they're saying. What is the emotion behind whatever they're saying? Or you can also reflect what they say the meaning, yeah, the content, the emotion, or the meaning. Or you can do a combination of all those three. Or you can even reflect an assumption of where you think they might go based on what they're telling you. You can get this wrong, and that's okay. If you do, they're just going to correct you. So I'm seeing dietitians not want to reflect or use reflections in session because they're scared that the clients are not going to like it or they're going to feel silly. Let me tell you, growth for any skill happens in the area of discomfort. So you got to get uncomfortable and then practice it, and then you're going to see how your clients respond, and it's actually going to be a really good response. The next one is, oh, I have a comment from Brittany. I'm going to read this one out loud. Now, you know what? Using reflective listening in conversations with friends can also help them feel heard and seen. I found that it can be practiced in day-to-day interactions too. Thank you, Brittany, for saying that. Yes, you can practice it with your partners, with your friends, with your kids, and it's all about taking the focus off of you and putting it on the other person, which is not what normally happens in day-to-day conversations. So that's why they tend to be or feel more unnatural. But once you start getting into the practice of trying it out little by little, it can really enrich how the other person feels in the conversation. Then we have making them feel valued. And we can do this by actively engaging them, asking them open-ended questions, making sure they know that they're the ones driving the car. You're there to guide them. Asking for their input and thoughts. Hey, you can even ask them, like, what did you enjoy the most from our session? What did you find the most valuable? That gives you some feedback on how the session went. And then it also helps them know that what they have to say matters. Emphasizing their autonomy is going to help them remember or believe that they are in control, and they actually, yeah, it actually is their responsibility. You're there to support them, not to do the work for them. In a nice way of saying that, right? And then feel empowered. If you know anything about the last version of motivational interviewing, the 4th edition that came out, I think it was end of last year, they changed one of the components of the spirit of MI to empowerment. And that's because in healthcare providers, even the term itself almost makes us believe that we are there to provide something, to install something that wasn't there previously with our clients. But we can change that into an empowering conversation where we are there to tell our clients, you have what it takes to take it to the next level. You have what it takes to make this change, and I'm here to help you find it. So then how can we increase their self-confidence, self-efficacy, so that they can start making changes and they believe that change is possible and that the change is going to lead to their desired outcome. So then these are the types of conversations that we practice a lot again and again in our coaching programs. And all of this comes down to this particular quote that I love by Dr. Maya Angelou. And it is, people will forget what you said. People will forget what you did. But people will never forget how you made them feel. I remember this quote was in the staff room in the clinic where I used to work. It was a substance use rehab facility. Every single morning I would clock in, I would see that quote. And every single morning I would start and end my day with that quote until it finally got it into my head that it's not about what you said. It's not about what you do, but it's about how you make people feel. So as dietitians, what we do matters, but how we do it in a way that's empowering to our clients and makes them feel heard, valued, empowered is going to make the whole difference when it comes to their client experience, patient experience, and client retention. So I'm going to end with, I guess I have a couple more, 2 more slides. What we're taught to focus on following the nutrition care process tends to look something like this on the left. So you go into session ready to do a nutrition assessment, eager to determine the nutrition problem, identify the highest priority nutrition interventions, provide nutrition education, and go into planning and setting up SMART goals. Nothing wrong with that. Probably 99% of you or all of you did that at some point, myself included. Give me a 1 if this is something that you typically do without reading the other half yet while I drink a sip of water. Now then, how can we shift these? How can we shift this process to focus on an approach that increases client retention and focuses on behavior change? So this is shift here. You go into the session ready to prioritize connecting with your client, exploring what drives their desire or their need to meet with you, their big why, their big reason for changing. Assess their attitudes towards behavior change. Help the patient find an intervention that they're ready, willing, and able to work on. Evoke intrinsic motivation as needed, not too little, not too much. And collaborate on how they will reach their high confidence goals while emphasizing their autonomy and empowering them to believe that change is possible. How do you think these two approaches are different? You can type it into the chat if you want. What's striking to you between approach 1 and approach 2? Okay, we have connection. Yeah, that connection is missing on the first one. Anything else that comes to mind when you're noticing the differences here? The second is patient-centered, client-centered. Absolutely. The first one is not necessarily collaborative. The second one, the client is in charge. Yeah. So then what we might be doing on the first one, it's not wrong. It's just missing. It's missing some things that are going to increase the client experience to make them feel like, wow, like this is a dietitian that I want to work with. Like this is the person that I want on my side. Like I want this person on my team because behavior change is not easy and I want this person with me every step of the way. That's the difference here. So you ready for the next 5 mistakes? Give me a 1 if you're ready, or a yes. Okay, so I'm just gonna show you the next 5. We're not gonna go into them. Not managing expectations. I see this quite a bit. Someone just got back from school. Hi, sweetie. So not managing expectations. This means that we haven't had that conversation with clients and their expectations might not be where they need to be, and then they drop off. Inappropriate goal setting process, number 7. So there's a lot more to goal setting than having SMART goals. Ignoring the stages of change and not coming up with appropriate interventions or coaching strategies based on the stage of change. Not using reflective listening and taking on the burden or responsibility for behavior change on yourself instead of putting it back on the clients. So which of these, and you have this on your worksheet as well, which of these do you feel like you need to prioritize in your own practice? It could be all, it could be just 1 or 2. I'd love for you to just take a second and like maybe check off on your worksheet or just share with us which ones you feel like there's room for progress or for improvement, should I say. Okay, I'm seeing 10, 4 and 10, 3, number 3, 1 and 3, 10. So someone said, can you explain not managing expectations again? Yes. So this is basically when you fail to, can you please get down?
You're stuck.
You're stuck. Okay. I need you to please just get down for a second. Okay. Why is it on wedding? Okay, sorry about that. So not managing expectations is when your clients are coming in with unrealistic expectations. Many times this is going to be based on diet culture. They're expecting to maybe, I'm just going to share the most common ones. Maybe they're expecting to share a certain amount of weight within a certain amount of period of time. Maybe they want to shed like 10 pounds the next month. So then we want to ask them what they're expecting to get out of working with us. And as we're hearing them talk about it, we should also be sharing what they can expect from working with us. So then we share what the behavior change process tends to look like. And based on your experience, maybe based on research, based on the effort they're going to be putting in, this is what they can expect to see when it comes to some of the results of their behavior. So we do talk about our locus of control. This is all in the hybrid program. We also talk about, so basically these 10 things are the things that make up the things that we practice for motivational interviewing and counseling and coaching in the program. So I would love to give you a minute. No problem. Give you a minute. You just wrote down which ones you feel like you need some support or you need to improve on, and that's great. I would love to hear what things were your main takeaways from today's webinar based on the information that I shared. What was your main takeaway? If you can share that, that would be amazing so I can see what resonated with you. What was your main takeaway? Eating is a behavior. Yes, Debbie. Nutrition is a science, but eating is a behavior. Sure, you were listening. Absolutely. So if you still have anything else, you're gonna type into the chat. I would love to read it. Let me see. Evoke what topic they say they want to discuss. Not taking the burden of responsibility for behavior change. Education versus counseling. Rephrasing their concerns. Yeah. Thank you for typing that in. Switching my mindset to being a behavior change coach. Yes, it's a good one, huh, Casey? Reflecting back to the client. Knowledge does not equal change. Practicing by reflecting and evoking before planning. Yes, these are skills that will not happen on purpose. So the way I see counseling skills and coaching skills, it's almost like learning a new language. You don't read a book on how to learn Spanish, right? You get the knowledge and then you start practicing and you make mistakes and you keep on practicing. But you're going to need a supervisor most of the time. If you want to learn how to play the piano, you don't read a book on how to play the piano. You start to play, you get feedback, you get that support and coaching and mentoring, and then continue practicing and you get really good at it. This is no different. Will there be a replay? Yes, there will be a replay. And I will be reading all of these messages. I did see some earlier up that you sent directly to me. I'm going to get to all of them. But I want to make sure that those of you who need to leave, we are done with the webinar at this point. This is the point where I'm going to share what I offer to the Nutrition Counseling Academy to take your counseling and coaching skills to the next level. If you don't want to hear it, so now would be the time to hop off. This is in the sake of full transparency and consensual selling, because that is a priority and that is part of my values. So someone asked, what is the number one predictor of positive client outcome? Can anyone else answer that one? Let's see if you caught it from the content. The number one predictor of positive client outcomes is a therapeutic relationship. Yes, you got it. And this will be, the replay will be sent out to you. Yes. So then let's shift some gears. And remember, I still have the raffle at the end. So the Elevated Nutrition Counseling Skill Building Framework is what I came up with based on my knowledge from my own journey, teaching nutrition counseling and talking with dietitians, reviewing their sessions. It basically looks at all of these 10 mistakes and it goes into depth, how to avoid them, but it's heavily focused on behavior change science, the therapeutic relationship, and counseling fundamentals at the baseline. Then we go into the stages of change, appropriate interventions, how to apply motivational interviewing in a way that you make it your own so it doesn't feel so unnatural. And then the third part of this is changing your mindset, going from educator to coach to nutrition counselor, behavior change coach. We go through real life scenarios and we have that peer-to-peer support. So this is what is going to change your approach when it comes to client sessions. And a big addition that I had as of this last year or this year is that I now use the latest AI technology to actually review your sessions. So you know exactly where you need to improve. And this is part of the program. And this hybrid program I'm going to be offering starting in end of October, you are going to be basically practicing. So it's going to be heavily based on practice and getting feedback on your practice. You're practicing in a low stakes environment. Within our calls, you're going to get feedback. You practice it on your own. I review your sessions. This is the fastest way to accelerate your proficiency in your counseling skills and motivational interviewing. But don't take my word for it. I'm just going to share testimonials from 3 different dietitians who have been through the program. One said, my confidence has been growing exponentially over the past 6 months. I have already seen Joyce's suggestions help me with current clients over this past year. My sessions flow so much more smoothly. They're still client focused, but stay on track more than they used to. I feel like I have the skills now to bring sessions back on track more than I used to. I am more clear with clients regarding how sessions are laid out and the expectation they can have moving forward. Dietitian of almost 40 years that joined the program last year, and I've been supporting her. Then we have Catherine, who mentioned Joyce's program has been a true eye-opener and game changer for me, from how I deliver programs to my clients to how they respond, how they have more self-reflection for results rather than looking to me to make the change for them. It really helps them dig deep into their why. So that last round which she was in was 12 weeks, was fabulous. I will definitely continue with the workbook because you do get a workbook and her membership program for ongoing support. This is exactly what I needed to be the dietitian coach that I want to be for my clients. Catherine, dietitian of 25 years. You don't need to be a new dietitian. Well, you can be if you want to enhance your counseling skills, but it doesn't matter where you're at. If you're realizing that that might be the missing piece of the puzzle, then I will be happy to support you. And lastly, we have Lucy. Lucy says, this program has given me the confidence I needed to feel comfortable in my client sessions. My clients now feel heard and understood. I am able to better connect with my clients, which allows them to open up and have better success with the goals that they set. Overall, they're having better long-term success, which is also means that I'm more fulfilled in my private practice. Lucy is someone who had been an inpatient dietitian for 14 years before moving to private practice. And this is the same story for many dietitians. They're making the switch from inpatient, potentially from outpatient, but moving into private practice, they're realizing that it's a whole different ballgame. It's like you're showing up to a tennis match with a baseball bat, whole different thing. So then what can you do if you want to take your skills to the next level? I'm introducing the Elevated Nutrition Counseling Certificate Program. And this is going to be a 6-month worth of support for those of you who want to enhance your counseling skills. It includes self-led lifetime access to all the modules, which you would get access to immediately, 30 CEUs for dietitians and dietetics. You're going to get a workbook full of practice examples, scripts, and handouts sent to you if you're in the US or in Canada. You're also going to, this is the workbook right here. I have a sneak peek as well if you want to check it out. And I'm going to have the link to this shared in the chat as well. You have 6 months of supervision and support, which is going to be split up into the first 4 months of bi-weekly practice calls, so every other week. And then you're going to remain in the alumni program for 2 months to continue to get supervision and support and coaching. And you can also get your sessions audited, your counseling sessions, whether these are mock or real sessions using the AI software. You're going to get 3, so baseline, middle, and end if you're in the regular, or if you want to upgrade to VIP, then you can get 1 weekly. Now, through Friday, if you're watching the replay, if you're here live through Friday, you're going to also get 30% off with the pre-sale price coupon, which is on the chat right now. So this ends up being you can join for as little as $165 a month for 6 months using this coupon. You can pay in full as well if you want. You can also join with the pre-sale coupon. Pre-sale is only good through Friday. Yes, your replay will be available and sent out to you today. But using this pre-sale coupon, you're going to save a whole bunch. So you're saving $400. And what's unique about this, no one else in the dietetics world is using this. You're going to have access to the latest AI software to review your sessions. You're going to get like a breakdown of everything that you do or you say and how well you're implementing motivational interviewing. You then get a score. So then it's not only my subjective feedback on how I think you're doing, it's also an objective score of how well you're implementing these counseling skills into your sessions. So each one of these on its own is worth $99. You get 3 with the program, and then you can always upgrade if you want more. So I wanted to share that through Friday, you get that 30% off with the pre-sale price with this coupon. After that, it's going to go up to the early bird price. So that's going to be, instead of $165 for 6 months, it's going to be $199 for 6 months until October 10th. And then you're going to get the full price. Now, if anyone that wants to join already did the self-paced program, you get a special price. Or if you are in the Empowering Change membership, where I do all the nutrition counseling and coaching, presentations monthly, you also get a special price. So let me know if you're interested. If you have any questions, I'd be happy to share what it looks like. And you can also schedule a call with me if you want me to answer any questions, if you want to take a sneak peek. I believe I also have a video that you can check out, that you can see what's in the program. Like this video, I made it a couple of months ago, but starting on minute 148, you can also check out the course library, basically. Anyone have any questions? Let me know. I'm here. I'm going to stop the share. Okay, you made it till the end. Thank you. Bye.